It's hard to imagine Jamaica without thinking of a good plate of curried goat. The presence of curry on our shores is one of the many contributions made by indentured Indians who came here to work long ago. It also reinforces the advantages of immigration and how it can enrich a nation's cultural diversity. The Indian Constitution came into effect on January 26, 1950, which declared India as an independent republic. The usual ceremonies to mark the day were dispensed in Jamaica. Instead, the Indian High Commission to Jamaica put on a series of free medical camps across Jamaica.
Hundreds of Jamaicans were able to access crucial health services on Sunday, January 31, thanks to the Indian High Commission in Jamaica. They spearheaded a series of medical camps across the island, manned by trained general and specialist doctors. The free medical camps was an innovative way by the High Commission to celebrate India's National Republic Day. The first stop by the Indian High Commissioner was the medical camp at the Constant Spring Library in Cassava Peace, Kingston.
How many doctors are participating in the camp?
In this camp, 4 doctors. It's Dr. Reddy, Dr. Anil, and Dr. Sheikh, and Dr. Ram Shetty, 4 of us.
What will persons attending the camp receive?
Okay, basically we're going to do basic checks. We're going to check their blood pressures, their sugar levels, and also give them a general checkup. And urine also, we're going to do urine check as well. And we're also giving out medications if somebody needs any medications. Yeah, basically this is a drive to find out, like, if somebody has a condition like a blood pressure or diabetes and they didn't know about it. So this will help, to basically diagnose and, start the treatment.
Take your deep breath, sir. Take your deep breath. Take your deep breath.
More than 40 doctors put in their hands and heads together to come and support us. And it's just one appeal. And that's it. All of them just came forward and volunteered. We have identified 13 locations across 9 parishes. That is available on the ad that we put up in both Cleaner and also in the Observer. I think that's everywhere. So 13 locations in 9 parishes.
The team of Indian doctors, assisted by nurses, took the medical facilities to those who might otherwise not easily access free health care and medical supplies.
I just want to say thanks to the Mayor of Kingston and St. Andrew and the Indian High Commission and all the persons, the community persons that are involved. I really feel elated about this because this ground where we are at presently was once a health center. But it has been removed over time, and persons that lives in the community has to go by the Ednaman Health Center, which is in the Shortwood area. So they complain from time to time about the distance and the long wait.
Prescription and over-the-counter drugs were provided free to the medical camps for distribution by several Indian global pharma companies.
More than 500 kilograms of medicines which have come from them, and these medicines are all essential medicines like blood pressure, cholesterol, diabetes, things like that, and other antacids, all common medicines and medicines which are quite costly in the market. So we have tried to make sure that people get at least some medicine 1 month or 2 months, whatever dosage is possible. And in addition, we are distributing masks and water bottles, everybody who comes here, keeping with the social protocol.
The first health fair I've ever been to, and I think it's terrific. I like the settings, it's very good. And I'm happy that things like this happen in our community.
Many also flocked the 2 medical camps held in St. Catherine. The young and old were able to see doctors without lengthy delays. Not only were tests conducted and prescription dispensed, persons with long-term conditions were advised how to take control of and monitor their health.
Go to your regular doctor, you follow you up and see how you're doing. Yeah. And then you need to work on, because you're young, and then the blood pressure can cause problems like kidney damage, eyes, heart failures, and those things.
We are glad to be a part of that contributing our services to the community in recognition of the India Day. Giving a day to the people to serve, which we've been doing all the years, as I said, but this is a auspicious occasion, and we are proud to be in Jamaica as well as to be Indian in Jamaica serving the country.
The fact that we are going through challenging time economically and people have it finding it difficult to even go to the doctor too and to finance medical assistance. So therefore I really support and endorse this idea today where the Indian Commission in partnership with the worship the Mayor of Spanish Town to put on this medical care delivery to the citizens of Spanish Town and its environment.
The early detection and diagnosis made by highly qualified and experienced multidisciplinary Indian medical team, along with the 500 kilograms of medication, are seen as invaluable.
Cost is not important. What is important is the spirit of the doctors, the spirit of the pharmaceutical companies. At just one appeal, they have come forward and say, okay, let's give back to the community. I think that's the beauty of this camp.
This is the genesis of even greater things to come, because we want to start plan this initiative for 2022.
I must say this is a wonderful innovation and assistance by the Indian High Commission. And I know that there are other High Commissioners, many from the European countries, who have been very, very helpful. And I encourage them, High Commissioners and Ambassadors, to render help to Jamaican people as much as they can, as I encourage Jamaican ambassadors elsewhere to render help where we can. And so at this time when this is a global pandemic, all hands must be on deck. And I'm willing, particularly today, very happy particularly today, to identify the Indian High Commission. And I know other High Commissioners and Ambassadors are helping Jamaica at this time, and we appreciate them too.
For the news on PBCJ, I'm Carol Francis.